I'm Dr. Srivats Bharadwaj, Pediatric, Preventive and Special Needs Dentist, practicing at Vats Param Dentists, Bangalore. So COVID actually, according to me, brought some good changes that healthcare was definitely requiring, I would think. And I would not think that COVID was the worst thing that happened to our people and stuff like that. However much we had a lot of losses of lives and disabilities. But from an overall healthcare practice perspective, I think it's brought some good changes because it has reinforced the need for standard practicing protocols among dentists, and as well as our Indian Dental Association, which has done a fantastic job in reinforcing what precisely is required in terms of practice guidelines and stuff like that. And most importantly, I saw a lot of dental clinics renovating themselves to newer protocols. Some of the challenges, of course, that we all faced was to refurbish equipment, to buy in some of the new sterilization equipment and stuff like that that were required, and the supplies of those were hard and short, which also impacted price points, so we had to pay a lot more, and so that was it. But right now I think things are easing out. However, one of the greatest challenges that there is a set aside on price points. There has been an increase in the price points for whatever we are kind of working on, may it be the labs, may it be raw materials that we consume to work on patients, and so there's been an upsurge of that, so which will impact patients in a way slightly towards cost-effective healthcare protocols. And one of the greatest other negatives of COVID was surely the academic scenario, because it was very pertinent for a doctor to be treating patients for his learning, and unfortunately COVID did not allow that. So disallowing patients into practices at the dental school level caused a huge impact because students did not get to work on patients. So my fear is that this couple of years of the batches of people who studied dentistry probably did not get hands-on skill. The concepts that they learned in theory, to implement them in practice, could there be a gap? And so I would think there has to be a regulatory authority that must come in to actually identify this COVID batch and give them some sort of clinical strong support so that they don't lose confidence and they are capable of actually being better dentists. So as far as our practice at Vats Param is concerned, we really did not have to make huge changes in our practice because we always followed barrier technique, we always wore PPEs, we always followed all the standard operating protocols. And most importantly, as you have seen our practice, that each operating room is a separate entity and there is no chance of cross infection. So we did not actually go through a worth of making huge changes in our protocols, either in our equipment and stuff like that, luckily for us. But the good part is that most practices that probably weren't following will start following, because now people are aware that there can be contamination through aerosol, that a room must be left empty for at least 20 minutes before we taking in another patient, because there can be a contamination of sorts. And most importantly, the only challenge that we went through was reinventing new staff members who came to join us, to take them through the protocols that are required for their own safety and for the safety of others working in this environment. So that human behavioral change was the challenge that we actually went through. So as we all know that 95% of all dental problems are preventable. So the focus for me and Dr. Paramjot at Vats Param is that we want to be the leaders in this oral healthcare industry, where we want to have a two-pronged approach, where on one side we want to educate people, especially COVID taught people the importance of oral health, and people are now getting more aware of what we've been talking about, the impact of oral hygiene on their general health, your diabetes, heart health, stroke, liver diseases, kidney diseases. A host of health issues are actually kind of predisposed by poor oral hygiene status. And on the other hand, our oral healthcare professionals itself, who need a lot more guidance. So at Vats Param, we are very, very focused on approaching these two situations. So on the patient side, we would like to do more and more of education to patients who will start focusing on prevention. Coming to a dentist is not going to solve all your problems. We as oral healthcare professionals can do only guidance and treat your acute conditions, but that is not good enough. That's only 5% of the problem. 95% of the problem can be resolved at your home by taking preventive oral hygiene measures. So we would like to do initiatives in educating people about that. And on the other hand, we also would like to educate dentists on what's the right way to approach patient care. How do you set up your dental clinics? So we have something called as the League of Dentists, where we want to start initiating dentists to practice the right way, teach them the right business approach, teach them the human side of dentistry and just not the business side of it. How do you scale your practice? How do you actually be an affable, kind, compassionate, and a great dentist with whom patients can connect to? And how do you scale your practice and be happy about your profession? Ultimately, at the end of the day, everybody wants joy. And that is our second initiative. So we would like to scale on these aspects. We are in talks with a lot of other people who are very keen and interested, and there are a bunch of dentists who are already training with us, as well as a huge number of patients being benefited through this.